Warning today from local healthcare providers about some alarming flu numbers already this season right here in the tri-state. Medical reporter Liz Bonus joins us now with why we could be headed towards a really dangerous season. Liz, I'm hearing lots of reports from people talking about just how bad the flu is this year.
It is some scary times. A new statement this past week by the top infectious disease physician in the country says this year's flu season now shaping up to be one of the worst in decades. Now, it's tough to know for sure if this trend will continue. I did reach out today, however, to providers all over the tri-state and found we've had an alarming jump in numbers in just the past few weeks.
But right now we've seen probably at least 10 kids within the school with flu just this week.
For weeks now, here at HealthSource of Ohio's West Clermont Wellness Center, they've been seeing sick kids with the flu. It's attached to the middle school, so Natasha Adams, the district superintendent for West Clermont, told us she feels lucky they can send sick kids right next door.
Well, the teachers are able to have an outlet and have an answer that's actually kind of Johnny on the spot. It's very unique, and being able to build a community of health to be able to reach our students in new ways it's very unique in a school system.
But this week, infectious disease specialist Dr. Fichtenbaum told us at the University of Cincinnati Medical Center it is not just kids getting sick, it's adults too. He said right before Christmas, since the start of the flu season here, they had about 36 confirmed flu cases. This week, more than 3.5 times that amount at 127. Hamilton County has had an uptick in all flu activity. Butler County has reported at least one death from the flu. And the Northern Kentucky Health Department confirms 1,634 reported cases with 3 deaths. No word on how effective this year's flu vaccine is yet, but you can still get it. And if you do get the flu,
because the flu is a viral infection, it's just treated for symptom management. There is Tamiflu, but you don't have to have Tamiflu to treat the flu. That's just for symptom control. So Tylenol, ibuprofen, fluids, going home and not sneezing or coughing on people and washing your hands.
now keep in mind, Ohio tracks flu activity, Kentucky actual flu cases. That's why those numbers are so different. The bottom line, it's up everywhere. And it's generally the flu, if it hits you suddenly, lasts about 7 to 10 days. So far, providers tell me the worst complaint right now has been when people feel it about on day 4 or 5. As for how we measure up against the rest of the country, we are right now alongside most other states showing widespread activity. That's according to the latest maps from the Centers for Disease Control and Prevention.